Hi, and welcome back to 90-Day Dental Day 52. So we've taken a bit of a break with the everything going on in the dental world over the last couple of days, but we're back onto the program again and back to finishing off the topic that we'd already started. I hope you've all had a good weekend and hopefully back on track and ready to look at some dentistry. So we've covered two sections or two parts of whitening, and I wanted to concentrate on the final bit of all the different whitening procedures today. So we've spoken about home bleaching and and a couple of the different options involved with that, and we've touched on shade matching and the other sort of science behind whitening. And we're going to take today to concentrate on power whitening and deep bleach whitening, which are two other aspects that are well known in dentistry, but we just want to go into them in a bit more detail today. So when we say power whitening, the majority of us will probably the majority of your patients will call it laser whitening. The one system that I'm going to talk very slightly about is Zoom, just simply because it's the most famous one, the Philips branded one. And the way we do power whitening nowadays, especially, this is for the UK market, the highest concentration that we can legally use is 6% hydrogen peroxide. So you're not going to get a significant change in that 2-hour period. It must be accompanied by a home phase afterwards. It's always considered as an initial brightening phase in the surgery. What that means is that you're doing it so that you can get an initial brightening, and you must top that up with home whitening afterwards as well. The home phase is the bleaching phase. You will need a 2-hour appointment for it if you're using the Zoom system. Other systems may be a bit less. The main reason for that is that it will take you a bit of time to get the safety equipment on, the rubber, the dam, the gels and everything else, and to get set up, and also to make the whitening trays and the bleaching trays in a lot of the situations and get those ready at the start of the appointment, and to do the assessment. The actual whitening process itself takes about an hour, but the befores and after bits in terms of the preparation are the lengthy parts that take the time. Predicting the success depends on age and wear of enamel. It's the enamel that makes it easy to whiten with power whitening. If it's a younger patient, you will get a much better result, mainly because the enamel they will have will be a lot thicker. The older a patient is, the thinner their enamel and the thicker their dentine layer. And the dentine layers are the C and D shades that will be much harder to whiten. So A and B shades generally will whiten well. Another sensible thing to measure as well is the dehydration shade. The reason that's sensible to measure is because you've got to whiten lighter than the dehydration shade. What that is you measure the shade at the very beginning before you start, and then once you've got all the dam and everything else on, and the teeth have been dry for long enough, you then also measure the dehydration shade. And the reason for that is if you don't lighten, and this is a general rule for whitening, if you don't lighten higher than lower and better than the dehydration shade, it's got to be lighter than that, you're not going to see a major significant change in the long run. Because when the teeth rehydrate, they will go back to their darker color again. So hence the reason why over whitening is normally very good, but you need to know what you need to over whiten for. So this is the setup in a typical Zoom. You've got if we start from left and go all the way to right, we start with the soothing oil. You've got then the various cotton wool rolls and buds that are needed. You've then got the syringe in the middle, which has 2 different sizes to be able to apply the dam, which is light cured, and that's to protect the gums and the gingivae. You've then got the pH booster, which is in the 2 white syringes, and that's painted onto the teeth before the actual gel, which is in the next syringes, the 6% hydrogen peroxide concentration, which is placed prior to each application of 15 minutes with the light. And then you've got the suction tube that comes with it as well. Each of these is a 1-patient kit. So just to bear that in mind, this is the entire kit that you will need for each patient. With Zooms, you have the chips that are inside the actual units that are plugged in for each patient, which come with them. And also you have the special cheek retractors, which will also help to keep the tongue back and out of the way as well. That's the actual Zoom kit and outline. The actual Zoom process itself is 4 lots of 15 minutes, hence why a 2-hour appointment is just about enough from start to finish to get a patient assessed and treated, and also to go through the instructions of the home whitening with them afterwards as well. So as far as that side of it is concerned, one of the other treatments that we actually do quite often is deep bleaching. The way that differs, and a perfect example of this is the Enlighten system. The way it differs is in the tray design initially. So you've got very tight fitting rigid trays with large reservoirs and a cervical post stamp to prevent leakage. And it's that retention which causes or helps the product to get so much deeper actually into the enamel. The product itself is refrigerated during the manufacture and transit to minimize the degradation of the gel, so it will be the freshest you can get, which does make a difference. And also it helps with sensitivity, or doesn't help with sensitivity. The difference within the Enlighten system in particular, if we're using that as an example, is that patients do actually see the results quicker. Because of all these factors that we've mentioned, it does penetrate more, it does lighten quicker. So patients usually don't mind the extra sensitivity, even though they get the additional swabs, they get the additional instructions to help minimize and control it. They do actually see results quicker, and they're happy to persevere with it if they're warned about it in advance. The process itself is fairly straightforward. It's using 10 to 16%, first week of 10%, second week of 16% of carbamide peroxide overnight for 1 week each. Prior to that, you are using the Enlighten Tooth Serum toothpaste, which helps to minimize the sensitivity afterwards. That initial potassium nitrate, potassium fluoride will help to bring down the sensitivity levels when they actually start onto the gels. This is all followed by 2 lots of 20 minutes in surgery, which they bring their trays in, of application of 6% hydrogen peroxide as well. That is to, as they say, seal in the final result and just give them that additional boost as well. So most cases are finished after 2 weeks, but in dark or tetracycline cases, inevitably you will need a lot longer, and there's no denying and no doubting that. And that comes from the diagnosis at the very beginning. There is the Enlighten B1 guarantee to be able to get to the end results if you've diagnosed and assessed well. The other downside to Enlighten is the more chair time that's needed. Therefore, it's a more expensive treatment. I mean, you call it a downside, but it's the results are going to be better. So inevitably, the patients will need to pay more to be able to get those guaranteed results and to get the additional guaranteed exposure of the whitening gels on there as well. The 2 final ones to just sort of finish off the jigsaw puzzle there that we've gone through today, and I hope that's been useful. It's been a great pleasure finishing off the whitening section. We've got 1 more to go and we'll finish that tomorrow. And until then, good luck to everyone getting ready to go back to work in the UK, and we will catch up with you soon. Take care.